blood glucose levels. So we need to see more of these values. Now, when somebody with diabetes takes his or her drugs and decides to go and exercise without eating, remember, if the person is taking drugs that will push the blood glucose low. Yes. Exercise also does the same thing. Of course, that person will go hypoglycemic. So, and at that point, when there's nothing to eat, you want the blood glucose to come up, then the person could take, if I would say, 3 cubes of sugar and you drink. But regularly just taking sugar, no. But some people say, oh, I don't want anything sweet. I'm avoiding apple. I'm avoiding pineapple. That's wrong.
Which brings us to Okafor's third point. He was talking about what foods can one take.
Well, advice will go back to our traditional foods. Foods with fibers, high in fiber, gari, amala, you know, pounded yam with a lot of vegetables. Though some traditional foods have a lot of oil, I don't encourage that. Everything should be done in moderation. Then we should eat vegetables. I mean, we should eat colored foods. Your food should be colored. You should see green on your plate, you know. Red, green, those kind of things. They are healthy, not just white, rice, amala, and all that, you know. Let's have a mixture.
Okay, let's just quickly talk about the child again. There's been a question on my mind. Some children with diabetes are really young. Yes. Really young. Yes. We see children. Yes. Having to take insulin injections. Yes. What is the prognosis for a life? How does that child live? I've seen in some movies, I don't know if it's true, you know, correct me, where maybe a child is kidnapped and the mother has gone ballistic because she has to give him an insulin injection at a certain time, and that's what's on her mind. Is that how their life is? Can they expect to live long?
It's sad, but the child can actually be on top of the situation. There are cases in Nigeria of children diagnosed with diabetes below the age of 1 year. I've seen a nurse's child, 5 years old, has diabetes. I've seen 10, I've seen 11, you know. So because of the type of diabetes they have, because they don't even have insulin at all, like the adults that have insulin that is not functioning.
They have no insulin.
No, they don't have insulin. The beta cells in the pancreas, that's the organ that produces insulin, the beta cells have been destroyed completely. So they require insulin injections for life. So, but we teach.
Let's quickly take this call and come right back to that. Okay. Hello.
Hello.
How are you doing? What's your question?
My question is on this
You need to turn down the volume of your TV set.
What I'm saying is that you asked me that what my question is, right? Hello?
Is your TV set on? You need to put it off so that we can hear you.
It's on, I mean, it's down now.
Okay, go ahead.
Okay. I'm a diabetic patient. I'm on Lantus, and I take lots of vegetables and everything as the speaker just said. But I'm still, my sugar is still a bit high. And I don't know what else I can do. I think I dip my mouth a lot and some certain things. But it's still a bit high.
Okay, thank you very much, Abimbola. I think I got most of what she was saying.
It's on Lantus, which is a form of insulin.
Okay.
And she takes veggies, I heard that.
Yes.
Then she said her blood glucose
but the blood glucose is still high.
Yes.
So what would you advise her to do?
Well, the treating diabetes is more of giving personalized, individualized care. The patient before me, what are the issues with this patient? How old is this person? I would like to know. You know, apart from the Lantus, because usually we don't give Lantus standalone. We give with some tablets.
Something else.
Yes. Is she on something else? Was she giving any target? Because she says her blood glucose is high.
Is she self-checking or has she been seeing the doctor?
Yes.
That's another thing, because I know they can check themselves.
Yes. But if they check themselves and they are not giving targets, they don't even know what is high, what is low. Because sometimes you've heard people saying, my blood glucose is high, it is 70, I wish it is lower. Anything below 70 is unacceptable. It is poor glycemic control. Okay. People that have blood glucose of 50, they don't have symptoms, they die in their sleep.
What's our normal range?
Normal range is 70 to like 110. Okay. But now, depending on the age of the person, we could say, okay, you can go a little above 110, but nobody goes below 70.
Okay.
Because below 70 is too low. So for this lady that called, I would advise she goes to her doctor. She should ask the doctor what her target. They should determine her target. What are her habits like, you know? Is she sedentary? Does she go to work? What else is she taking with the Lantus?
So adjust it to fit her.
Yes.
Okay.
So she might just need to increase the dose, add some other medications. So it's a one-on-one, face-to-face thing.
Patient-centered. Thank you so much for coming on the program, Dr. Vera. That was wonderful.
Thank you.
We'll do it again some other time.
Thanks
for being with us. Abimbola, thanks for your call. Pt.4, thank you very much. Enjoy the rest of your day. I am Mary Alale Yusuf.